Have you been told to do nerve flossing for neck pain, arm tingling, or heaviness in your arms? If so, you've probably heard the terms nerve sliders, nerve flossing, and also nerve tensioners. Many people think they are the same thing, but they're actually very different exercises. One type is usually much safer when symptoms are irritated. The other can be incredibly useful when used at the right time. Today I'm going to show you the difference between nerve flossing and nerve tensioning, when to use each one, when not to use nerve tensioners, and how to do them both properly for your brachial plexus, your ulnar nerve, your median nerve, and your radial nerve. By the end of this video, you will know exactly which technique is most appropriate for your situation. Our nerves are not fixed in place. They actually slide and glide through tissues when we move. When a nerve becomes irritated, inflamed, compressed, or insensitive, it doesn't move with as much ease, it becomes restricted. And this may contribute to various symptoms such as neck pain, arm pain, shoulder pain, numbness and tingling into the arm or the hands and fingers, burning sensations, and tightness with movement. Nerve flossing and nerve tensioner exercises are designed to restore normal nerve mobility, but they are two very different ways of doing this. Nerve flossing, also known as nerve sliders, are exactly what it sounds like. We're encouraging your nerve to slide through the tissues with minimal tension on it. Think of pulling a rope through a tube. Because nerve flossing places low tension on the nerves, it is generally more gentle, better tolerated, better for situations where you're in a flare-up, and great for beginners. For example, when nerve flossing the brachial plexus, you'll have a flexed arm and flexed wrist, and you'll have your head bent away. And when we do the flossing motion, you will slowly open your arm and unflex your wrist and tilt your head in the same direction. So the nerve is pulling that way, and now we are pulling the nerve back. Nice, slow, relaxed movement. But you can visualize the gliding of the nerve back and forth. Now let's talk about nerve tensioners. A nerve tensioner intentionally stretches the nerve from both ends. Now your nerve experiences substantially more load on it. The benefits to nerve tensioners is that it can help mobility of the nerve, it can help improve tolerance to movement, and it can help people in stubborn cases where nerve flossing is not helping enough. But they are also more provocative, which means they should be used carefully. This is one of the most important parts of this video. Avoid nerve tensioners if your symptoms are highly irritable. For example, you try nerve flossing and that aggravates your symptoms. Pain shoots down your arm easily. Symptoms linger for hours afterwards. Symptoms are progressively worsening. A common mistake is assuming that more stretching is going to give better results. With nerves, that's often not true. An irritated nerve generally responds better to gentle, calm movement before you can progress on to more aggressive stretching. If symptoms progress significantly, stop the exercises immediately and consult a healthcare professional. This is how you progress from nerve flossing into nerve tensioners. Step 1 is to start with light nerve flossing for 1 to 2 weeks. If you feel okay with that and your symptoms are not aggravating, then step 2 is you can progress into nerve tensioners, but start lightly with them. Floss first, then add on the nerve tensioners. Each time you want to do nerve tensioners, start with a little bit of nerve flossing first and then add on the nerve tensioners. Think of this as mobilize the nerve first and then load the nerve second. This progression is often much better tolerated than just jumping into nerve tensioners right out of the gate. If you want to see more videos on fixing neck pain, headache relief, posture correction, and nerve irritation, make sure to subscribe. Now I'm going to demonstrate how to do various nerve flossing and nerve tensioner techniques, and we're going to do this real time. I would like you to do the exercise with me. So get on up and let's get ready to do this together. First, we're going to start with the brachial plexus. The brachial plexus is a group of nerves that comes off of the neck. It congregates in the front of the shoulder area, and then nerves branch off of the plexus in the shoulder that go down into the arms. The nerves of the brachial plexus can get irritated and restricted in this area. So to do brachial plexus nerve flossing, we're going to flex our arm and wrist and bend our head away. And then we're going to extend our arm and hand while we tilt our head towards the affected arm. And then we're going to go back and flex and tilt the head away. This is the gliding aspect of flossing. Right now the nerve is moving back and forth as we make a nice, slow, controlled movement. Keep your arm parallel to the floor. Don't let it drift down. You may feel and experience a little bit of tension in the front of the arm or across the front of the shoulder, and mild tension is okay. If you experience pain or increased numbness and tingling that is becoming concerning, then go ahead and stop the exercise right away. Our aim is to do 8 to 12 reps, which we are almost done. Don't let it speed up like I just did a second ago. One more. Fantastic. That's nerve flossing. So if you do that for a week or two and you don't have any aggravation of your symptoms and you want to try nerve tensioners, this is how we do nerve tensioners. Same beginning position with the arm and wrist flexed, but this time your head will tilt towards the affected arm. And now as we extend the arm and wrist, we will flex the head away. Now we're lengthening the nerve. We're going to hold this for a few seconds, longer than a nerve floss, and then we're going to go back and we're going to stretch again. Let's hold these stretches for 3 to 5 seconds. Keep your arm up. Don't let your arm drift forward. It's best to keep it back. That keeps the stretch going across the plexus. And let's aim for 3 to 5 nice stretches. We're on number 3, holding for 3 to 5 seconds. And now let's do number 4. And our last one, number 5. I can feel that pull right through here, down the top of my biceps into my hands with a slight tingling sensation. Fantastic. Now we're going to nerve floss and nerve tension the second of our 4 nerves, the radial nerve. The radial nerve runs down the outside of your forearm and into the thumb and index finger. So you can feel burning, pain, tightness sensation through here, numbness and tingling into the thumb and the index finger if your radial nerve is irritated. To floss the radial nerve, you're going to drop your arm down beside your side. You're going to take your hand and scoop it back like you're looking for a low 5 from your friend. Then you're going to bring your arm back and out to about 35 to 45 degrees. And at this point, you'll probably feel a little bit of tension going along the outside of the arm, and that is okay. That's good tension. So we're going to bend the head away. And now we're going to do the flossing motion, which is extending the wrist back and tilting your head towards. And then we're going to go back, nice slow controlled motion, wrist is flexed, head away, extend wrist, head towards. We're going to do 8 to 12 reps, nice slow steady motion. Don't let your arm drift forward too much as you do this exercise. You want to maintain good positioning. If you start to get too much numbness or tingling in your hands, or you start to get pain down into the arm or the neck, go ahead and discontinue the exercise. Let's just do a few more. Be careful, I'm speeding up there. Got to keep it slow, smooth, keep the hand back. And one more. Fantastic. That's nerve flossing for the radial nerve. Now we're going to do radial nerve tensioners. Same setup, hand down by your side, flexed wrist, arm back, out to the side. But this time your head is going to be tilted towards your affected arm. And now as we extend our wrist and we tilt our head away, this is performing the tension, the stretch on the radial nerve. We're going to hold this now for 3 to 5 seconds. Remember, nerve tensioners is more of a holding position, not a constant flossing back and forth. We don't need to do as many nerve tensioners. We're going to do 3 to 5, holding for 3 to 5 seconds. And count for 3 to 5. If your symptoms begin to progress and you feel too much discomfort or tingling in your hands or pain in your neck, go ahead and discontinue the exercise. Let's do one more. And we're going to hold for 3 to 5 seconds. I feel a tension currently down the shoulder and the arm, and relax. That is radial nerve tensioners. Well done. If you found this helpful, comment below and let me know which nerve floss technique helped you the most. Our third nerve is the median nerve. The median nerve runs down the middle of your arm, and if it's irritated, you can get symptoms into the palm of your hand. If this nerve is chronically irritated, you can have carpal tunnel syndrome. To nerve floss the median nerve, you're going to put your hand down by your side, rotate your hand out, bring your arm out to the side, and at this point I can feel tension going through the front of my forearm. We're going to start with our head away, and as we flex our wrist, we're going to bend our head towards the affected side. Extend the wrist, head away, flex the wrist, hand towards the side. Smooth, steady motion. As always, 8 to 12 reps. Mild tingling and tension is okay, but we're stopping if we experience severe numbness, pain, or discomfort that's worsening. Remember to keep your movements nice and slow. Don't rush. Maintain good form and position. Don't let your arms start to drift down by your side or pull forward too much. And let's do 2 more. You're doing great. Fantastic. So now if you're ready to progress into nerve tensioners, we're going to put your hand down at your side, rotate your hand out, bring your arm out, but this time you're going to bend your head towards the affected side, and as you flex your wrist, you're going to bend your head away, and here's the stretch. Now we're creating tension on the median nerve. We're going to hold this for 3 to 5 seconds, and then we're going to go back to neutral. And then we're going to go ahead and flex the head away as we flex our wrist. Keep your arm in a good position. We only need to do 3 to 5 of these. So we're going to do number 3 right now. If the tensioners cause too much discomfort for you, that means you're not ready for them, or it's not the right exercise for you. And last one. Let's hold for 3 to 5. Feel that stretch and release. Great job for doing median nerve tensioners. If you're enjoying my nerve flossing versus nerve tensioning video, give me a thumbs up, consider subscribing to our channel. All of your support helps us in the future to provide more videos to help you with neck pain, arm pain, headaches, and your overall health. Let's get back to our nerve flosses and nerve tensioners. Now we're going to do our 4th and final nerve, the ulnar nerve. So the ulnar nerve runs along the inside of the arm that goes down into the pinky and the ring finger. So you can get numbness and tingling sensations into the pinky and ring finger if you have an ulnar nerve irritation. Also, if you hit the inside of your elbow, the ulnar nerve is the nerve that can cause that sensation that your hand is falling asleep. You know, the funny bone. That doesn't feel so funny when you hit it. To floss your ulnar nerve, bring your arm up to the side, pinch your thumb and your index finger together, and as you flex your elbow, go ahead and rotate your hand so your pinky comes up and you bring your hand back by your neck. So to nerve floss, we're going to extend our arm, tilt our head away, and then come back with the pinky up, head tilted towards that side, head away, open up the hand and extend your arm, pinky up. Make sure to keep your arm up while you're doing this. We want to do 8 to 12 reps, as always. So let's do a couple more. Nice, slow, steady motion. You may feel some tension, some light numbness and tingling into your fingers. In fact, I feel a little mild tingling into my 4th and 5th fingers right now. And one more. So that's how we nerve floss the ulnar nerve. Now to do nerve tensioners for the ulnar nerve, you're going to start in the same position. We're going to bring the hand up, rotate the pinky finger up, but this time your head is going to be away. So now we're going to tilt the head back as we extend our arm and rotate the hand back around. Flex your elbow, bring the pinky finger back up, tilt your head away. Now as we tension, we want to go ahead and hold the tensioner for 3 to 5 seconds. So let's hold this a bit longer. Fantastic. Now we're going to relax. And now we're going to tension again. Hold it for 3 to 5 seconds. Keep your arm up. maintain good posture. If your symptoms become too strong, discontinue the exercise. We like to get 3 to 5 stretches here for 3 to 5 second holds. I'm going to do one more after this one. This is feeling fantastic. And there we go. So the ulnar nerve flossing and tension technique is a little more technical with how you hold your hand and movement, but practice it and I'm sure you'll get really good at it. Let's address a few common mistakes that can happen when we're nerve tensioning. The most common thing that I see is that people stretch too hard. The nerves are irritated and we don't want to irritate them more. We have to walk that fine line that we are moving the nerve, we're stretching it to help it in the future, but we don't want to hurt it more. This means you need to listen to your body. A little bit of soreness and tension is okay, but if you start getting pain while you're doing your nerve tensioners, you need to discontinue the exercise. The second thing that I notice is that we let our technique waver. So don't let your arm fall, don't let your wrist not bend enough. We want to stay conscious and focused on our technique while we're doing our flossing and our nerve tensioners. The third mistake I see people make is that they just simply do too many repetitions. Don't wear yourself out. Try to stay within 8 to 12 repetitions, and if you need to do less in the beginning, then do so. And the fourth mistake is that people ignore their symptoms. Listen to your body. If you start getting too much pain or excessive numbness, tingling in your fingers while doing the exercises, discontinue immediately and then try again the next day. It's not always worth it to push through. You might set yourself back. If you can be aware of these 4 common mistakes and prevent them from happening, it will greatly improve your results. So in summary, nerve flossing is a more ideal starting point. Nerve flossing puts less tension on the nerves, it's more gentle, and is better if you are in a flare-up. Whereas nerve tensioners are better if you are further along in your recovery, if you feel like you're not getting enough change from your nerve flossing and your nerve flossing is not aggravating you. They provide more tension, so they must be introduced carefully. Remember, the goal here is not to stretch your nerves as hard as possible. The goal is to get your nerves moving properly again to reduce inflammation around them and let your body heal better. So start with gentle nerve flossing, 8 to 12 repetitions, 1 to 3 times a day. And if you handle that well and you're coming along well in your recovery, then you can add nerve tensioners in where you do 1 to 3 sets a day, 3 to 5 repetitions, holding the stretch for 3 to 5 seconds at the end point. Remember not to stretch too hard, listen to your body, maintain good technique, and enjoy the exercises. If you found this video helpful, please give a thumbs up and subscribe. And if you have any questions, just leave a comment below and I will get back to you as soon as possible. I'm Dr. Rob Murray with Murray Family Chiropractic in Newmarket, Ontario, Canada. I'm a corrective care chiropractor, and that is nerve flossing. Take care. I'll see you at the next video.